I'm a fellowship trained breast surgical oncologist, and I've had a lot of questions recently about what positive margins means, and I wanted to explain that to you guys. So, this is an example of a lumpectomy that I personally performed a few years ago. And you can see that the O-shaped clip is right in the middle of the cancer, and that there's a cancer in the middle of the lump that I've removed. The margins means the edges of the tissue that I've removed and whether or not they're free of cancer. And a positive margin means that I have cut through cancer and left cancer behind, and a negative margin means that I have removed all of the cancer successfully. In this particular patient, I had negative margins, and I've always had negative margins. I use a number of tools in the operating room and have never had a lumpectomy where I've had to go back and take out more on one side or the other because I've left cancer behind. But that does happen about 20% of the time nationally. Now, it's important that if the edges or the margins aren't clean or negative, that the surgeon takes you back to the operating room and takes out that positive margin as soon as possible. Sometimes when the surgeon takes you back and they take out a little extra piece on one side or the other, the pathology report comes back from that piece and it doesn't actually show any cancer. And sometimes people will ask me on social media, well, does that mean that I didn't really need to have that surgery? And the answer is no. Even if that extra piece doesn't show any cancer cells that we've been able to find, we still know that the cancer was right up to the edge of what the surgeon removed the first time, so it was still important to make sure that they got out more tissue to confirm that cancer hasn't been left behind.